Hi everyone, my name is Kelly. Welcome back to Forward Therapy. I am a certified hand therapist, and in today's video we are talking all about golfer's elbows. If you've been having pain on the inner side of your elbow, likely due to repetitive use or overuse injury, this video is for you. Let's go ahead and get into it. Now, just a little bit of a backstory. What is golfer's elbow or medial epicondylitis? It is a tendinopathy of the tendons on the inner side of the elbow. So what that means is that the tendons that attach on our inner side of our elbow, which help us to bend our wrist, our fingers, to help rotate the palm in a downward position, have been overstretched, likely due to overuse or repetitive activity. The hard thing about this condition and other tendinitises or tendinopathies is that they can take a really long time to resolve, and it can be really frustrating to be recovering from this injury. Unfortunately, it's not unusual for it to take 12 to 16 months for something like this to resolve, but it should gradually be getting better with the combination of resting it, in other words, avoiding the aggravating activities, activity modification, so maybe changing up the way that you do things to put less stress on that tissue, and then a combination of pain and edema management, right? Trying to help bring the pain down, get some of the swelling, if there is a lot of swelling, under control, and doing some rehab exercises that can help offload the tendon and then help to reload it or rebuild some of the strength to that tendon as it heals. As always with any injury, I always recommend talking with a doctor or a rehab professional like an OT or a PT to talk about an appropriate treatment plan for you so that you can get a customized assessment, figure out where you are in the phases of recovery so that you don't do the wrong thing or hurt yourself. But I want to give a few simple exercises that I tend to give in my practice over the course of time with golfer's elbow. So hopefully these will be a helpful start for you. One thing that I would recommend trying, especially if you've been dealing with the symptoms for a chronic amount of time, so longer than a couple of weeks, I would try using heat on the affected area. So you could do that using a heating pad or a hot pack, something like this. You can actually use uncooked rice, pop it in a pillowcase, and then put it in the microwave until it gets hot. So you can use a heat pack or a heating pad, whatever you are able to do, and applying it to the affected area. And if you can do that 2 to 3 times a day, 10 to 15 minutes, just bringing in a little bit of blood flow to the area, sitting on a heat pack, taking some nice deep breaths, that can be a really helpful way to start controlling or decreasing your pain overall. For gentle stretching that you can do, I generally recommend trying to do some sort of gentle movement, gentle stretching, taking postural breaks, getting your body moving a little bit out of the position that you're in every 2 to 3 hours, especially if you do something very repetitive or activities that put you in a static posture for long periods of time. Try to take those breaks every 2 to 3 hours throughout your day to get a little bit of movement. Some stretches that may be particularly helpful when you are experiencing pain at the inner side of the elbow are doing some forearm stretches, so bringing the arm out in front of you. If the elbow is uncomfortable to straighten, you can keep it bent at your side at a 90-degree angle. And then using the other hand to bring the wrist down towards the floor. You don't need to crank on the wrist here, just getting a gentle stretch through the forearm. And then holding for about 30 seconds. It's always good to switch sides and do the other arm as well. Holding for 30 seconds. Next, you can move into the opposite direction, so bringing the first arm up, pulling the wrist back. Make sure that you're not just pulling your fingers back, that you're getting the whole wrist and hand pulled back. 30-second hold, taking nice deep breaths, switching hands, going the opposite direction. And holding for 30 seconds. And then the third stretch that you can try for the forearms is turning the palm facing up and then pulling the fingers and wrist back. Again, making sure that you're not just pulling your fingers, but that you're getting your whole hand and wrist back. If that feels really intense for you, bring the elbow in at your side at a 90-degree angle. And then we can switch hands, going the opposite direction, getting a nice stretch to the forearm. And again, if that feels too intense, bring it in at your side, 90-degree angle. So these stretches could be completed every 2 to 3 hours throughout your day. You can break it up however you feel like it's comfortable. They should not be causing pain, especially sharp or shooting pain, but they may be a little bit uncomfortable, like a pull or a stretch. So those can be very helpful. Next up, we're going to use our good old soup can. I don't have any light dumbbells at home. If you have some that are 5 pounds or under, this might be a good exercise to do with those dumbbells. If it's a lot heavier than that, you may want to find an alternative object. So find an armrest or your knee or the edge of a table where you can support your forearm on. I'm going to tilt the camera down just a bit here. So loose grip, gentle grip on the weight or the soup can. You're going to lower your wrist down slowly towards the floor and then use your other hand to bring it back up into a bent position. So from the side view, we're rolling it down slowly and helping it back up. So we're lowering the weight down and then helping it back up. All of this is done slowly, nice and slow with control. And remember to breathe. Don't forget to breathe. You could do 3 sets of 10 of this exercise once a day or every other day. That would be a really nice strength-based exercise that can help to reload and recondition the injured tendon when you are ready. So what that means is when the pain is starting to come down, then you can start to reload the tendon. Again, I always recommend working with a PT or OT, especially if you can work with a hand therapist or a PT that specializes in upper extremity rehab, just so that you can get a proper assessment and then get a proper rehabilitation program that's customized for your needs. But this hopefully will be a helpful start. Thank you so much for watching this video. I hope that it was helpful for you. If you liked it, if it was helpful, please give it a thumbs up, comment below, subscribe to the channel so you don't miss other hands therapy videos, and I'll see you in the next one. Thanks for watching.